Maintaining proper body alignment while client is at rest on bed. Purpose: to comfort and rest, prevent strain on muscles, prevents contractions. Special consideration: to position the client correctly, the nurse must have knowledge of anatomy and good body alignment. Usually, clients are repositioned every 2 hours. However, some clients may require more frequent repositions to prevent skin breakdown. Without 24 hours repositioning schedule, repositioning by the inadvertently omitted. 4. Pressure source readily develop the bony prominences. 5. Positioning aids like pillow, sandbags, footboard, and strong cardboard cartons may use aids. Supine position. Supine position, the patient lies on her back with his head and shoulder are slightly elevated. One pillow is given under the head, his legs, shoulder width slightly flicks. A small pillow is placed under his knees. Purpose: to provide complete bed rest, to examine the abdomen, to perform abdominal surgery. Suggested action, principle or rationale: place the patient flat on his back, check spine or straight alignment, support the head with pillow, to prevent neck extension, place arms straight on his side and folded on the chest. Maintain the hands in fractional position. Use cotton rings at the elbow heels and ergotion under the buttocks to prevent bed sores. Use footboard or a bed-ridden patient to prevent foot drop. Ma'am, okay lang po na kayo? Lalagyan ko lang po yung dito yun. Okay lang po. Okay lang po. Komportable naman po kayo. Have safety device in place, protect clients for injury. The pillow and board is safety device for the injury. And 8, wash hands, maintain asepsis. And last, record the procedure to reference and legal purposes. And ma'am, thank you for your cooperation. B, row position. A patient lies flat abdomen, head turned to sideways, one soft pillow is given under head. The head are the slides of beyond the head, and extra pillow to given under the ankles to keep toes from touching the bed. Purpose: to examine the back and spine, to relieve pressure and bony prominence. Suggested actions, principles or rationale: place the patient flat in his bed, the abdomen, place arms straight on his side, turn the face of one side. Pwede pong to add his comfort without defeating the principles of good alignment. Place hand rules if needed. Pwede ko pong magyan ng arms. Okay lang po ba? Hawakan ko yung paa. Okay lang po. Position client feet under between mattress and footboard are used under ankles. This will be keep the feet if proper alignment providing the plantar flexion. Okay lang po yung position nyo. Have safety device in place, the pillow or face towel. Protect client from injury. And last, wash hands, maintain asepsis, and record the procedure to repair and legal purposes. Thank you. C. Fowler's position. Fowler's drain fluids from the abdominal cavity to change the position of the patient. Suggested action, principle or rationale. Place the patient in a sitting position. Raise the head of the bed to angle between 45 to 70 degrees for support. Maintain the position by use of extra pillow, a proper body alignment, and support the arm on a pillow. Okay na po ba nalagyan ko kayo ng dito or pillow? And for the support in the legs, with the pillow again. Okay lang po. Use footboard to prevent foot drop. Raise the knee with pillow to prevent patient from shifting. Kami doon na yung sa foot, bago dito. Have safety device in place. The pillow protects client from injury. Next, wash hands, maintain asepsis, and record the procedure for reference and legal purposes. D. Lateral right and left position. Definition. Patient lies on left side and legs flexed at tight. The upper legs is flexed more than the lower. A pillow is kept in front of the abdomen and at the back and one under the upper leg. Purpose. To give enema, to change position for bed lying position of the patient, to insert rectal suppositories, to take rectal temperature, to perform surgery on rectum. Suggested action, principles or rationale. The patient placed on his side with one pillow under the head. The pillow may provide added comfort. Place both the arms and front of the patient. Place the lower leg slide up with upper leg half bent at the knees to help provide balance. Mamang ilang po na itas pa. Then, harap po kayo dito sa akin. Use pillow to support the head, back, arms, and abdomen. For support, place one pillow between the knees. First, I'm going to use pillow. And for the knees. To keep the legs separate and takes the weight of the upper leg. Support the feet and right angle to prevent plantar flexion of foot drop. Have safety device protects from the client from injury. Wash hands, maintain for asepsis, and last, record the procedure for reference and legal purposes. Same position is similar for the lateral position, except the patient weight the anterior aspect. For the patient shoulder, middle on hip, the patient lower arm is behind him on the upper arm is flexed at the shoulder and elbow. Purpose. It is used for unconscious patient to prevent tongue falling back from the throat, to examine the rectum, allow rections and drain from the mouth. Suggested actions and principles are rational. Place the patient on his left side. These positions provide access for rectal area, for the administration for enemas, and for examination for rectal area. Ma'am, okay lang po na itagilid po kayo? Yes. Keep the left arm behind the back at the head, incline forward. Flex both the legs with the upper knee higher than the left knee. Place one pillow under the head with the left cheek on it. for the knee, I'm going to use yellow. Ma'am, okay na po na may position nyo. Comfortable naman po kayo. Have safety device in place. Protect client from injury. And next, wash hands, maintaining asepsis. And record the procedures for reference and legal purposes. Trendelenburg's position. At Trendelenburg's position, the patient lies on his back. The patient's head is low. The foot of the bed is elevated a 45-degree angle. The body of the inclined place and the legs hang downward over the end of the table. Purpose: use the examination of the pelvic organs to treat shock or postural drainage. To promote venous return, to decrease blood pressure. Suggested actions and principles or rationales. Explain the procedure to the patient. To allay anxiety to promote patient's cooperation. Ito po yung position na ito para ma-improve po ang inyong lalagyan ko po dito ng unan. Okay lang po ba? Para maging okay po yung position. Arrange the article lead to the bedside. Provide privacy. Place the patient lead on his back. Elevate the foot end of the 45-degree angle. The body is on and chest straight with hips. Okay lang po na nalagyan. Straight na po. Okay lang po. The knees are flexed, the legs hang downward over the end of the table. Left-to-tummy position. The patient lies on her back. The legs are separate and tight with the flex on the abdomen. And the legs are on tight. The patient buttocks are kept an edge of the table and legs are supported for the stirrups. And the purpose is, the position is given during a gynecological examination, treatment and operations, and genitourinary system, and for the delivery of baby. The last purpose is for rectal examination and operation. The suggested actions and principle or rationales is the patient place on her back with the legs raised and flexed. Keep the buttocks resting on the edge of the bed. And the two legs of the patient is separate the knees like that. To provide the visibility of the cranial area for the purposes of examination. Support the legs on the stirrup. And for the privacy of the patient is we need the blanket. And that's all for the lithotomy dorsal recumbent position. The patient lies on back, knees polyflex tight, flex and externally rotate, feet flat on the bed. So the first purpose is to examine vulva, vagina, and the rectum. To perform operative procedures on the vulva area. To categorize the bladder. The first suggested actions is place the patient on his back. Separate the legs of the patient. Flex the knees. And for the procedure is place the foot and flat resting on the bed. So the foot of the patient is flat on So use one pillow under the head and shoulder. Are you okay, ma'am? So, and I'm going to use the blanket for the position of the dorsal position. Are you comfortable, ma'am? And last for the eye is genopectoral knee or chest position. The purpose is if we use the rectal procedure, suggested actions, principle or rationale. First is have the client kneel on the bed or table with the hips of air chest with the bed or table. Ma'am, okay lang po ba na idapa ko kayo for your position? Are you okay, ma'am? So, if special table is available of the client, kneel on platform with the head and chest with the table and rib. To allow visible or the rectal area of the patient is the coverage of the rest of the body for warmth and modesty. So, ma'am, you need to up your then. Are you okay, ma'am? So for the patient position is like that. For the position is okay. So I'm gonna use the blanket for the like that position. So ma'am, are you okay for your position?
Yes.
So I'm done for the positioning in the bed of the patient. So ma'am, thank you for your cooperation and God bless for your help. So thank you, sir. I'm Aramiti Taktana again, and God bless.